The number you see on your blood pressure monitor can either quietly protect your life or slowly shorten it. And most people after 50 are looking at the wrong number without even realizing it. I have watched this for years. A man comes in, calm, confident, says his pressure is normal. He shows me 150/90 and smiles, because for his age, someone once told him it's acceptable. A woman tells me hers is 135, and she is worried because she heard it should be lower. Both of them are mistaken in different directions, and both are at risk, just in different ways. This confusion does not come from carelessness. It comes from outdated advice, fragments of truth, and a very human desire to simplify something that is not simple. You have probably heard phrases like, your age plus 100, or a little higher is fine when you're older. It sounds comforting, it sounds reasonable, and that is exactly why it is dangerous. The body after 50 does not become more tolerant to high pressure. It becomes more vulnerable to it. The vessels lose elasticity, the brain becomes more sensitive to fluctuations, and the heart works harder even when you are resting. What used to be a harmless number at 40 can quietly become a threat at 60. But here's where it becomes even more subtle. Lower is not always better either. I have seen patients who proudly lowered their pressure to very low numbers, only to begin feeling weak, dizzy, and mentally slower. Their blood pressure was perfect on paper, but their body was not receiving enough blood where it needed it most, especially the brain. So the real question is not high or low. The real question is balance. Precision. A range where your body feels stable, your mind remains clear, and your organs are protected over years, not just days. And this is where most people miss the point entirely. They chase a number instead of understanding what that number means for their own body. They measure occasionally, react emotionally, and then forget about it until the next appointment. Meanwhile, the body is giving quiet signals every single day. Slight fatigue, pressure in the head, poor sleep, irritability, small things that seem unrelated, but are often the earliest whispers of imbalance. Tell me honestly, when was the last time you measured your blood pressure calmly, at rest, without rushing, without stress, just observing your body as it is? Not after climbing stairs, not after coffee, not during anxiety, but in a true moment of stillness. Most people cannot remember, and that is exactly why this conversation matters now. Not 10 years ago, not later, but now, when your body begins to change its rules and the old habits stop working as they once did. There is one key principle, one detail that most people never hear from their doctors, not because it is secret, but because it requires time to explain. And yet it changes everything. How you interpret your numbers, how you feel day to day, and how you protect yourself from the most serious complications. I will explain it, but not yet. If you stay with me until the end, you will understand why many people with normal blood pressure still develop strokes and heart problems, and how to avoid becoming one of them. For now, I want you to stay with this thought. Your blood pressure is not just a number. It is a living reflection of how your body is coping with time. If you value clear, honest explanations without unnecessary complexity, support this conversation with a like and subscribe to the channel. It helps this information reach those who truly need it. And if you have ever been unsure about your own blood pressure readings, stay attentive, because what comes next may change how you look at them entirely. If we continue from this idea that your blood pressure is not just a number, but a reflection of how your body is coping with time, then the first thing that must change is not the number itself, but the way you measure and understand it. I often tell my patients something that surprises them. The most dangerous blood pressure is not always the highest one. It is the one you misunderstand. A man once came to me after a mild stroke. Not severe, he recovered well, but it left a mark. When we reviewed his records, his blood pressure was acceptable most of the time, around 140. Occasionally higher, occasionally lower. Nothing alarming at first glance, but when I asked him how he measured it, he told me something very common. In the morning, quickly, sometimes standing, sometimes after tea, sometimes after walking around the house. In the evening, rarely. During the day, almost never. What he had were not measurements, he had fragments. And fragments create illusions of control. The body does not live in fragments. Your pressure changes constantly, with movement, with emotions, with digestion, even with thoughts. But there is a baseline, a quiet level where your body shows its true state. If you never measure in that state, you are not seeing reality. You are seeing noise. This is why the first element, the foundation of everything that follows, is not medication, not diet, not even exercise. It is correct observation. Sit down. Rest for 5 minutes. No phone, no conversation, no movement. Your feet on the floor, your back supported. Breathe calmly, then measure. Do it at the same time in the morning and again in the evening. Not once, but twice with a short pause. Write it down. This may sound simple, even trivial. But in medicine, the simplest habits often create the most profound changes. When you begin to measure like this for several days in a row, something interesting happens. Patterns appear. You begin to see whether your pressure is truly stable or quietly fluctuating. You notice if mornings are higher, if evenings are calmer, if certain days are different. And this is where a small scientific fact becomes important. Studies have shown that variability of blood pressure, how much it fluctuates, can be just as dangerous as consistently high values. The vessels, especially in the brain, do not like instability. They prefer calm, predictable flow. When pressure jumps up and down, even within acceptable limits, it creates microstress on the vascular walls. Now think about this carefully. If you measure randomly, you will never see variability. You will only see isolated numbers, and you may falsely reassure yourself. I remember a woman in her early 70s. Very disciplined, very attentive. She measured her pressure properly, twice a day for a week before coming to me. Her average was not alarming, around 135, but her fluctuations were wide. Some readings were 120, others 150. She herself said, "I feel it, doctor. Some days I am clear, some days I am heavy." We adjusted her routine gently, not aggressively, and within weeks her numbers became more stable, not dramatically lower, but smoother. And she told me something very telling. "I feel more like myself again." That phrase is more important than any number, because the goal is not to chase an ideal value on paper. The goal is to restore a state where your body functions steadily, without strain. So here is a small task for you, starting tomorrow. Not a big change, not something overwhelming. Just observe correctly. Morning and evening, calmly, without rushing, for at least 7 days. Do not try to fix anything yet. Do not judge, just watch. Because once you truly see what is happening, the next step becomes much clearer. And it is exactly this next step that many people skip. And that is where problems begin to grow quietly, without warning. And when you understand this next layer, you will begin to see why the same blood pressure can be safe for one person and dangerous for another. And when you begin to see your own numbers not as Sluchini-Tsifri, but as a living pattern, something else becomes visible, the condition of your vessels themselves. Because blood pressure is never only about the heart pushing blood. It is always about the path that blood must travel. I want you to imagine a simple image. A young, healthy vessel is like a soft, elastic tube. It expands gently with each pulse, absorbs the force, and then returns to its shape. The blood flows smoothly, almost effortlessly. But with age, this elasticity changes. The walls become stiffer, less responsive. Now the same amount of blood creates more resistance. The heart must push harder. The pressure rises. This is not a theory. This is a physiological reality confirmed in countless studies. After 50, arterial stiffness becomes one of the main factors influencing blood pressure. And here is the important detail that many people never hear. 2 people can have the same blood pressure reading, but completely different risks depending on the condition of their vessels. I had 2 patients, both with similar numbers, around 140. One felt energetic, mentally sharp, physically stable. The other complained of fatigue, heaviness in the head, poor concentration. When we looked deeper, the difference became clear. In the second case, the vessels had lost flexibility. The pressure was not just a number, it was a sign of strain. This is why simply lowering blood pressure without understanding the vascular condition can sometimes create problems. If vessels are stiff, too aggressive reduction may reduce blood flow to sensitive organs, especially the brain. This is when people begin to feel dizziness, weakness, even slight confusion. You may have heard someone say, "My pressure is good, but I feel worse." This is often the reason. So what matters is not only the number you see, but how your body tolerates that number. Now listen carefully, because this is where your own observation becomes valuable. There are subtle signs that your vessels are under strain. Not dramatic symptoms, but quiet signals. A feeling of pulsation in the head. Sensitivity to weather changes. A sense that your energy is uneven during the day. These are not random. They are often reflections of how your vascular system is adapting. There is also a scientific marker that doctors use. Pulse pressure, the difference between the upper and lower numbers. When this gap becomes wider, it often indicates increased stiffness of the arteries. It is a small detail, but it carries important information. But instead of overwhelming you with numbers, I will give you something practical, something you can begin to feel, not just calculate. Pay attention tomorrow to how you feel at different times of the day, not just your pressure, but your clarity, your steadiness. Do you feel equally stable in the morning and evening? Does your head feel light or heavy? Do you feel calm inside your body, or slightly tense without reason? This is not psychology. This is physiology expressing itself in sensations. There was a man, a former engineer, very precise in his thinking. He once told me, "I always trusted numbers more than feelings." But after he began observing both together, he said something that stayed with me. Now the numbers make sense, because I feel what they mean. This is the level of understanding I want you to reach. Not fear of blood pressure, not blind control, but quiet awareness. And here is where the next layer opens, because once you understand your measurements and begin to sense your body, a natural question arises. What actually stabilizes this system from within? Not temporarily, not artificially, but deeply. There is one factor that influences blood pressure more than people expect, yet it is often underestimated because it seems too simple. It does not come in a pill, and it does not act instantly, which is why many ignore it. But when it is corrected, the body begins to regulate itself more intelligently, more calmly. If this way of understanding your health resonates with you, support it with a like and subscribe. It helps bring clarity instead of confusion to more people. And stay with me, because what comes next is not about controlling pressure, but about restoring the conditions where it no longer needs constant control. And when you begin to feel this connection between numbers and your inner state, you slowly come to a quiet realization. The body does not like to be forced. It responds much better when conditions are created for it to regulate itself. This is where we arrive at something many people underestimate: hydration. Not simply drinking water because it is healthy, but understanding how the fluid inside your body directly influences blood pressure and the work of your vessels. I will say something that may sound too simple at first, but stay with it. Blood is not just a liquid. It has a certain density, a certain viscosity. When you are even slightly dehydrated, this changes. The blood becomes thicker, the flow becomes more resistant, and the vessels experience more strain. The heart compensates by increasing pressure. Now imagine this happening quietly, day after day. Not severe dehydration, nothing dramatic, just not enough fluid. Many people after 50 drink less than they think. The sense of thirst becomes weaker with age. The body does not always clearly signal that it needs water, and so a subtle deficit becomes a constant background condition. I remember a patient, a calm, thoughtful man in his late 60s. His pressure was unstable. Not critically high, but inconsistent. Some days normal, other days elevated. We reviewed everything: medication, diet, activity. Nothing obvious. Then I asked him one simple question. "How much do you drink during the day?" He paused, thought, and then said, almost uncertainly, "I don't really pay attention." We did not change anything else. Only one thing: regular, steady hydration. Not large amounts at once, not forcing, but small portions throughout the day. After 2 weeks, his pressure became noticeably more stable. Not perfect, but calmer. and he himself said, "I feel less tight inside." That phrase again, less tight. This is how the body speaks when circulation improves. There is also a physiological mechanism behind this. When the body senses low fluid levels, it activates systems that increase vascular tone. In simple words, the vessels constrict slightly to maintain circulation. This naturally raises pressure. It is a protective response, but when it becomes chronic, it turns into a problem. Now here is where balance becomes important again. It is not about drinking excessively. Too much fluid, especially in a short time, can also create strain, particularly if there are issues with the heart or kidneys. The goal is steadiness. A glass of water in the morning, calmly, not rushed, then small amounts during the day. Pay attention to your body, not just to numbers. Notice how your energy changes, how your head feels, how your overall state becomes either lighter or heavier. There is also something interesting that many people notice when they begin this habit. The need for constant stimulation. Coffee, strong tea, often decreases slightly. Because part of that fatigue was not lack of energy, but lack of proper circulation. Try this for the next 7 days. Do not change everything at once. Just add awareness to your drinking. Not mechanically, but consciously, and continue measuring your pressure as you learned earlier. You may begin to see a connection. Not dramatic, not instant, but steady, and when this internal environment becomes more balanced, another layer reveals itself, because even with proper hydration, even with careful observation, there is something that influences your pressure more quietly, more deeply, something that works through your nervous system, often without your awareness. It is not what you eat, not what you drink, but how your body lives from moment to moment, even when you think you are resting. And when this is understood, many things begin to fall into place naturally. And when the body begins to receive what it needs physically, something more subtle starts to come into focus. The way your nervous system quietly shapes your blood pressure, often without asking for your permission. You may have noticed this yourself. There are days when nothing special happens, and yet your pressure is slightly higher. Not because of food, not because of activity, but because inside there is a certain tension. Not always obvious, not always emotional in a clear way, just a background state of alertness. After 50, this becomes especially important. The nervous system does not recover as quickly as before. Small stresses accumulate. The body does not reset as easily overnight. And this leads to a constant low-level activation of what we call the sympathetic system, the part responsible for readiness, for action, for survival. In simple terms, the body behaves as if it must always be prepared, and when the body is in this state, the vessels constrict slightly, the heart rate adjusts, and the pressure rises just enough to maintain this readiness. Not dramatically, but persistently. I once worked with a woman who insisted she lived a calm life. No major stress, no conflicts, but her pressure was consistently higher in the afternoons. We spoke at length, not only about her habits but about her daily rhythm. And slowly it became clear. She was always on alert. Even in rest, her mind was active, scanning, thinking, anticipating. We did not start with medication. We started with something much simpler, but much deeper. Learning to shift the nervous system out of this constant tension. And here is where many people expect something complicated. But the body often responds best to what is simple and consistent. Breathing, not in the abstract sense, but in a very specific, conscious way. Slow, calm breathing signals safety to the body. It tells the nervous system that there is no immediate threat, and when this signal is repeated regularly, the vessels begin to relax, the heart rhythm stabilizes, and the pressure gradually becomes more balanced. There is a physiological basis for this. Slow exhalation activates the parasympathetic system, the part responsible for recovery and restoration. It is not a theory, it is measurable. Heart rate variability changes, vascular tone adjusts, and over time baseline pressure can decrease. But again, this is not about doing something once and expecting a result. It is about creating a small daily habit. Tomorrow, choose a quiet moment. Sit comfortably. Inhale slowly through your nose, and then exhale a little longer than you inhaled. No strain, no counting strictly, just a gentle extension of the exhale. Do this for 5 minutes, that is all, and then observe how you feel. Not immediately after, but later, your clarity, your calmness, your sense of internal steadiness. A man once told me after a week of this, it feels as if something inside has stopped rushing. That is a very precise description of what happens, because the goal is not to fight your blood pressure. The goal is to remove the constant signals that push it upward. Continue your measurements. Continue your hydration. Add this breathing practice once or twice a day, and you will begin to notice that your body is not as unpredictable as it once seemed. But even this is not the full picture, because there is one more layer, something that acts more slowly, more quietly, but shapes your blood pressure over years, not days. It is built into your daily routine so deeply that most people no longer question it. And when this layer is adjusted, the changes are not temporary. They become part of how your body lives. And when these quieter layers begin to settle, when your body is no longer slightly dehydrated, no longer constantly tense, no longer reacting to random measurements, something deeper starts to reveal itself. You begin to see that blood pressure is not only about what happens in moments, but about how your body has been living for years. This is where we come to movement. Not exercise in the sense of effort or achievement, but movement as a daily condition of life. After 50, the body changes its priorities. It no longer responds well to sudden nagruska, to sharp efforts followed by long inactivity. What it needs instead is regular, calm, sustained movement, the kind that keeps circulation alive without exhausting the system. I often see two extremes. One person avoids movement, thinking they are preserving energy. Another tries to compensate with occasional intense activity. Both approaches create instability. When you remain inactive for long periods, circulation slows. Blood pools more easily, vessels lose tone, and the system becomes less responsive. Pressure may increase not because the heart is weak, but because the whole system becomes less adaptable. On the other hand, sudden intense effort can create spikes in pressure, especially if the vessels are already less elastic. The body is forced to react quickly, and this creates unnecessary strain. What the body truly needs is rhythm. I remember a patient, a former teacher, who came to me with complaints of fatigue and fluctuating pressure. She was not sedentary, but her activity was irregular. Some days she moved a lot, other days very little. We did not prescribe anything complicated. We simply created a daily rhythm of walking. Not fast, not forced, just steady walking at a comfortable pace every day at roughly the same time. Within a few weeks, something changed. Her pressure became more predictable. Not perfect, but stable. And she said something very simple. I feel more grounded. That word matters. Grounded. Because regular movement does not just affect the heart and vessels. It organizes the entire system. It improves the sensitivity of the vessels, supports better oxygen delivery, and even helps regulate the nervous system we spoke about earlier. There is also strong scientific evidence here. Moderate aerobic activity, such as walking, has been shown to reduce both systolic and diastolic pressure over time, especially in older adults. But more importantly, it reduces variability, the very thing that quietly damages vessels. Now, I want you to notice something. We are not adding separate, disconnected actions. Observation, hydration, breathing, movement, they are beginning to form a single system. Each supports the other. If you walk regularly, your circulation improves and hydration becomes more effective. If your nervous system is calmer, your vessels respond better to movement. If your measurements are accurate, you begin to see how all of this influences your pressure. This is how the body works, not in isolation, but in connection. So here is your next step. Not a drastic change. Simply introduce daily movement, even if it is just 20 minutes of walking. Choose a pace where you can breathe comfortably, where you are not straining, and do it consistently. Do not aim for speed. Aim for continuity. After 7 days, observe your pressure again. Not just the numbers, but the stability. Notice whether your body feels more predictable, more even. And as this rhythm becomes part of your life, something else begins to emerge. A deeper understanding, almost a quiet confidence. You are no longer reacting to your body. You are working with it. And this leads us to the final, most important layer, the one that ties everything together, the detail that many people overlook even when they do everything else correctly. It is not obvious, it is not often explained clearly, but once you understand it, the question, what is the best blood pressure, finally becomes clear in a way that truly protects you. And this is where everything we have discussed begins to connect into one simple but powerful truth. And when all these elements begin to work together, when you observe your pressure calmly, support your body with proper hydration, reduce internal tension, and restore natural movement, a very important question finally becomes clear in a new way. What is your best blood pressure? Not the number from a textbook, not what your neighbor says, not even a single value your doctor once mentioned in passing, but the level at which your body lives steadily, clearly, and without strain. This is the point many people miss. They search for a universal answer, when in reality the safest pressure is always individual within a certain range. Yes, there are general guidelines. For most older adults, values around 120 to 130 systolic are considered optimal if they are well tolerated. Sometimes slightly higher is acceptable, but here is the key detail. Tolerated by whom? By your body. I have seen patients who function beautifully at 130, clear mind, stable energy, good sleep, and I have seen others who feel heavy, slow, and unwell at the same number. For them, a slightly lower pressure feels natural and safe, and there are also those who, if pushed too low, begin to lose clarity and strength. So the real answer is not a rigid number, it is a corridor, a range where three conditions are present at the same time. Your pressure is stable without sharp fluctuations. Your mind is clear without dizziness or heaviness. Your body feels balanced, not strained and not weakened. When these three come together, you are close to your true optimal level. Now think back to everything we have discussed. Measurement gives you accuracy. Hydration supports circulation. Each breathing calms the nervous system. Movement restores rhythm. None of these alone defines your pressure, but together they reveal it. This is why some people take medication and still feel unwell, because the number is corrected, but the system is not, and others with slightly higher values feel stable because their internal balance is intact. There is also one more important scientific observation. As we age, overly aggressive lowering of blood pressure, especially below individual tolerance, can reduce blood flow to the brain. This is associated in some cases with cognitive decline. That is why modern medicine increasingly emphasizes individual targets, not rigid ones. So when you ask, what is the best blood pressure? The honest answer is this. The best pressure is the one your body can maintain steadily, where your brain remains clear, your heart is not overworked, and your daily life feels natural. Not perfect, but balanced. I want you to take everything you have heard and apply it gently. Not all at once, not with pressure, but with attention. Give yourself these 7 days. Observe, adjust, feel, and most importantly, stop fighting your body. Start listening to it, because your body is not your enemy. It is constantly trying to protect you, even when it raises your pressure, even when it reacts in ways you do not fully understand. When you begin to support it instead of forcing it, the changes are deeper and more lasting. There is one final thought I want to leave with you. Time does not ask whether we are ready. It moves forward quietly, but the quality of that time, your clarity, your independence, your strength, depends on these small daily decisions that seem insignificant, but are not. If this conversation helped you see your health differently, support it with a like and subscribe to the channel. Share it with someone who may still be guessing their numbers instead of understanding them. Take care of your body calmly, wisely, without extremes, and it will respond in the same way. Calmly, steadily, reliably. And when you begin to live with this understanding, not chasing numbers but creating conditions where your body can regulate itself, something very important changes inside you. The anxiety disappears. Not completely, but enough that you no longer react to every measurement as if it were a verdict. Because fear, even quiet fear, has its own effect on blood pressure. I have seen this many times. A person sits down to measure, already slightly tense, already expecting something wrong. The result appears a little higher, and this confirms the expectation. The body tightens further. The next measurement is even higher. A cycle begins, not of disease, but of reaction. This is not imagination. This is physiology. The moment you anticipate danger, your body activates. Vessels narrow slightly, the heart adjusts, and the pressure rises. Even the act of measurement can become a trigger if it is associated with worry. There is a term for this, situational elevation, but you do not need the term. You need to recognize the pattern. If you measure your pressure and feel a slight internal tension, pause. Do not immediately repeat the measurement. Sit quietly, breathe as you learned. Give your body a signal that there is no urgency. Then measure again. Very often, the second number tells a different story. I once worked with a man who kept a notebook of his readings, very disciplined, very precise. But his numbers were always higher at the first measurement. Always. When we discussed how he approached it, he admitted, almost with a smile, "I always expect it to be high." We changed nothing in his treatment, only the way he approached measurement. Within days, his average readings became lower, not because his condition changed dramatically, but because his reaction changed. This is a subtle but powerful point. You are not just observing your body. You are influencing it. And this brings us to something even deeper. Over time, repeated reactions become habits. The body begins to live in a certain pattern, either in calm regulation or in constant readiness. You can shift this pattern, not instantly, not by force, but gradually. Each calm measurement, each moment of conscious breathing, each steady walk, they are not isolated actions. They are signals. Signals that tell your body it is safe to function without excess tension. And the body listens. There is also an important long-term effect here. When the nervous system is less reactive, the vessels experience less chronic strain. This reduces the risk of damage over years. Not just pressure itself, but the consequences: stroke, heart problems, cognitive decline. These are not sudden events. They are the result of long processes. And this is why what you do daily matters more than what you do occasionally. Now I want you to add one more small practice. Not a new task, but a refinement. When you measure your pressure, do it without judgment. Do not label the number as good or bad immediately. Just observe it as information. Like a scientist, not a critic. Write it down. Let it be part of a pattern. This simple shift removes unnecessary tension and allows you to see more clearly. And as this clarity grows, you will begin to notice something almost surprising. Your relationship with your body becomes calmer, more respectful, less confrontational. You stop trying to fix everything at once, and instead, you begin to guide the process. And when this happens, one final piece falls into place. Not a technique, not a habit, but an understanding that changes how you approach your health entirely. It is something many people overlook because it does not feel urgent. But in reality, it determines whether all the efforts you make will bring lasting results, or remain temporary improvements that fade with time. And when all of this comes together, when you stop reacting with fear, when your measurements become calm and consistent, when your body receives water, movement, and moments of real rest, a very quiet but decisive understanding appears. Health is not built in moments of effort. It is built in the way you live when nothing special is happening. This is the detail that most people overlook. They wait for symptoms, for warnings, for clear signs that something is wrong. And until that moment, they postpone attention. But the body does not work this way. It changes gradually, adapting either toward balance or toward strain. Blood pressure is one of the clearest reflections of this process. It does not suddenly become dangerous overnight. It shifts slowly, influenced by daily rhythms, habits, reactions, and conditions you create for yourself. I have seen people who did everything right for a short time. They followed advice strictly, controlled every number, made sharp changes, and for a while the results were good. But then, slowly, they returned to old patterns. Not because they did not care, but because the changes were not integrated into their life. And I have also seen something else. People who made small, almost unnoticeable adjustments. They did not rush. They did not try to perfect everything, but they were consistent. Calm measurement, regular hydration, gentle breathing, daily movement, and over time, their condition became stable in a way that did not require constant effort. This is the difference between control and harmony. Control always demands attention. Harmony supports itself. Now think about your own routine, not what you intend to do, but what you actually do, day after day. This is where your real blood pressure is formed. There is also an important scientific truth here. Long-term studies show that consistency of lifestyle has a stronger protective effect than short-term intensive interventions. The body adapts to what is repeated, not what is done occasionally, but what becomes part of daily life. This is why I asked you from the beginning, not to change everything at once, because real change is not created by effort alone. It is created by continuity. And now we return to the question that brought you here. What is the best blood pressure for older adults? It is the pressure that your body can maintain without struggle, within a reasonable range, with stability, clarity, and internal balance. A pressure that does not exhaust your heart, does not deprive your brain, and does not fluctuate unpredictably. It is not a single number. It is a state, and you already have the tools to move toward that state. Not complicated, not extreme, but real. Observe calmly. Support your body with what it needs. Reduce unnecessary tension. Move regularly. And, most importantly, live in a way that your body does not have to constantly compensate. If you do this, your blood pressure will not be something you fear or fight. It will become something you understand. And this understanding gives you something much more valuable than control. It gives you confidence. Not loud, not forced, but quiet confidence that your body is working with you, not against you. If this helped you see your health more clearly, support this work with a like and subscribe to the channel. Share it with those who may still be relying on outdated ideas or случайные советы. Take care of yourself with patience and intelligence. You still have time to improve how you feel, how you think, how you live. And your body, if treated with respect, will respond with the same steady respect in return.